Hello and welcome to Project IMG Presents the
Okay, we are
USMLE Challenge
we're
in
live.
association with Amboss, MedQuest, Kaplan, and Metro Resident.
Hello and hola.
Assalamu alaikum.
Walaikum assalam and namaste.
We are your hosts and entertainers for today. My name is Umar Nisar. I am a medical graduate from Pakistan and currently preparing for Step 2 CK.
Hi everyone, I am Amol Dua. I've graduated from India and I'm also currently preparing for my step 2. And Omar and I really bonded over our fear of step 2.
High five.
I'm sure you're going to do great in your step 2. My name is Rocio Castillo. I'm from Chile. I'm ECFMG certified. I'm currently working as a research fellow at Mayo Clinic, Florida, and I'm applying for this year's general surgery match.
Good luck.
Thank you.
Good luck. Project International Medical Graduate, or Project IMG as it's fondly called, is a unique initiative taken by our founder, Dr. Victor Sebastian Aruvarana, aiming to help and unite IMGs all around the world, uniting diversity over one platform. Project IMG is your one tool for all the resources you need, not only for your USMLE, but also on how to get a residency position in your USMLE journey.
If you have not joined our server yet, please join today on www.projectimg.com. It is a free and dedicated buddy for all your needs for your USMLE, and even I found my step 2 CK prep partner there.
I have joined the research group, and trust me, it has helped me a lot.
That's amazing, Omar.
So how about we start introducing our sponsors?
Sure, Omar. We were going to start with Metro Resident, your #1 go-to for creating your program resident list.
Amboss, your partner for all your exam and referencing needs.
MedQuest, where you can rediscover your love for medicine with the great Dr. Conrad Fisher.
My favorite, Master the Boards, which gives you the edge you need for the USMLE success, and it personally helped me to get a really good score in the Step 2 CK.
And finally, the IMG event, which is the best place to network as an international medical graduate. Omar, will you be going to the IMG event in Karachi in November?
Obviously, Amol, who would miss that chance of interacting people in the same boat and networking at the same time? Did you go to IMG event in Delhi?
Oh yeah, ours was really informative and entertaining at the same time. I wish I could attend yours too.
Omar,
Then we could
Amol,
both meet as well.
Omar, Amol, and everyone else that's watching us today. You should really try to come to the IMG event in New York next year. I'm going to that one, and I'm sure it's going to be a blast as usual. And as Amol said, it's the best place to network. And you know that networking is the most important thing, especially when you're trying to match into a competitive specialty like me.
Definitely, Rocio. Thanks for letting us know. We'll see you there.
I'm sure you're gonna match. More power to you.
Thank you.
So, you guys have been watching us speak for a while. I would like to ask the contestants, what resources have you been using for your prep? So, Avi.
Hi, Amol. Thank you,
Hi.
everyone, for having such a beautiful session. Frankly, I am in the middle of my interviews for neurology, so I haven't gotten a lot of time. But I just gave my step 3, so I feel that the concepts that I made there should help me a little with that. Rather, I'm looking forward to a beautiful competition from such amazing people from across the world. So excited for that. Thank you so much.
Good luck.
Thank you.
So now for the format of the show. There will be 3 rounds: tetraplegia, Tecusate diagnosis to escape round, and the best round, connections. We will have 16 participants and a lot of breathtaking performances. So without any further, let's begin the first ever Project IMG USMLE Challenge.
Yay.
We have 2 amazing teams, the names of which are derived upon and from anatomy. You know, guys, we are medical geeks, but please don't laugh upon us. The deltoid daredevils and the quad squad, as in quadriceps femoris, those that we build in the gym. So, as we progress through the rounds, we will be renaming the groups, and those names will move from proximal to distal with regards to the respective team's winning limb.
So let's start with our introduction. What do you say, Rocio?
Yeah, I think we should start. And also, after Amol mentions your name, you should go and say either if you're a medical graduate or a student, which country are you from and what specialty are you interested?
So let's start with our first team, the Deltoid Daredevils. And the first contestant there is Mr. Amarjot Singh. Hi, Amarjot.
Where are you?
I think Amarjot's prepping for the upcoming challenge.
Marjot, you're muted.
Hello, everyone.
Hi.
I am in Delhi, currently in India, and I am recent graduated this year. And now I am preparing for step 2 CK. So I'm excited to be part of this challenge. Thank you.
Great.
Good
Nice
luck.
to meet you. Arpit.
Hi guys, I'm Arpit Singh. I'm a fourth year medical student right now, and I'm done with my step 1 exam. And currently, I'm preparing for I'm focusing on research and preparing for step 2 CK. And I'm hoping to match into some a neuropsych program. So I'm also quite excited for the challenge. Thanks.
Hi, Arpit. So Avi. Avi's given a brief introduction, but yeah, where are you from, Avi?
Hi everyone. So I am Dr. Ravi. I'm from India. I just graduated last year, and I've done my steps 1, 2, and 3 recently. I'm all the way in for neurology. I really can't imagine myself doing anything else. So I think I'm a little away from step 1 basics than everyone else over here, but I'll try to give it my best shot. All the best.
Good luck. Aisha.
Hello everyone, I'm from India. I recently graduated and I'm preparing for step 1.
Oh,
Good
then
luck.
like Aisha must be really fresh with her concepts then.
Maybe let's
Yeah.
see.
Bhavya.
Hi everyone, I'm Bhavya. I'm currently in third year, one of the younger ones around here. And I'm due to give my step 1 on 21st November. And really thrilled to be part of this challenge.
Good luck, Bhavya.
Thank you.
Hasid.
Hello everyone, I am Hasib from Lahore, Pakistan, and I am currently preparing for USMLE Step 2 CK. I am interested in internal medicine. Good luck to everyone.
Amol, before we continue, I want to remind the participants to rename themselves accordingly to the group they're in, the team.
Okay. So as we continue, Hashir.
Hello everybody, my name is Hashir. As you can see, I'm from Karachi, a final year medical student, and really happy to be here.
Nice to meet you, Hashir. Janish.
Hi everyone, my name is Janice. I am recent medical graduate from India, and I am currently preparing for my step 1, and I am interested in internal medicine.
Oh, nice. So that was the Deltoid Daredevils, and now we're moving on to the Quad Squad. So the first person we have there is Javeria. Is Javeria here?
Javeria, where are you?
Yes, are you able to listen me?
Yes.
Okay, hello everyone. I'm Dr. Javeria. I'm a graduate from King Edward Medical University, Pakistan. I'm done with USMLE Step 1 and currently preparing for USMLE Step 2 CK. I'm really excited to be here. Thank you.
We have Jose.
Hello everyone, I'm Jose Luis Villamarin. I am a last year medical student from Ecuador, and in the future I want to apply to internal medicine. Good luck for everyone.
Good luck. Kalika.
Hi everyone, I am Dr. Kalika. I recently graduated from India and I'm currently preparing for my Step 2 CK, and I'll be applying for internal medicine next year.
That's amazing. Kathan.
Hello, I'm Kathan and I'm a final year medical student from Gujarat, India. I am done with my step 1. I was done with it from last year, and I am hoping to apply for internal medicine.
Good luck. Muskan.
Hi everyone, myself Muskan. I'm a second year medical student from India. I'm hopefully the youngest here, and I'll be preparing for my step 1 next year.
Good luck, Muskan. Nisa.
Good luck.
Do we have Nida here?
Oh, yeah, hi. Hi everyone, I'm Nida. I am a graduate from India and I just got done with Step 2 CK last week. So all of my Step 1 stuff isn't as fresh as it was, but I'm interested to apply to emergency medicine. So good luck to everyone.
Guys, remember to rename yourselves. I see that only a couple of you have that so far.
So next on the quad squad is Shruti.
Hello everyone, this is Shruti. I'm a medical graduate from India. I'm preparing for my Step 2 CK right now, and I'm hoping to match into internal medicine.
Good luck, Shruti. Siddharth.
Hello guys, everybody. I'm a medical student from India, and I'm currently preparing for Step 2, and I'm hoping to match into general surgery.
Oh wow, that's a competitive branch.
So Amol, after hearing both the teams' names, which team are you supporting? And Rocio, you as well?
I'm going to support the Deltoid Daredevils.
Actually, me too, because as a future surgeon, that name gives me an adrenaline rush, you know?
I am seeing Amol and Rocio both are sporting team Deltoid Daredevils. Don't worry, team Quad Squad. I am excited combined as compared to Amol and Rocio. So mathematically, we are balanced. X equal to Y.
So moving on to the ground rules of the show. The participants are supposed to have 2 devices with stable internet connection and camera access. One laptop or a desktop is must for joining this event, and the other one for monitoring their screen. The latest application of Zoom is required. Camera and mic must be turned on at all times. Please make sure that your sitting area is devoid of any external noise. It is highly discouraged, and if it interferes with the challenge, you will be given a warning by the host. The participants are required to make their hands visible to the screen at all times. They can keep it relaxed and however they want it, but hand visibility is a must. During discussions, they are not supposed to make it chaotic, and please make it well coordinated.
Amol, are there any rules for discussion on screen?
Definitely. Those who know the answer should put up the hands up emoticon. The emoticon is visible in the reaction section on Zoom. So could you please try that right now, contestants? Could you put your hands up? Oh, you guys are really quick.
Yeah. Oh my God.
Okay. Please note that only the leader can use the mouse to readjust the Zoom screen so that he and she can see whoever's raising their hand. But other than that, everyone has to keep their hands in clear view, and even the leader, after they're done, should keep their hands in view.
Amol, so you mean that only those showing the hands up emoticons can discuss amongst themselves? None other, correct?
Yes, that is correct. And the designated team leader must decide who answers. And guys, keep in mind that the team leader cannot answer. She has to decide the person who gives the final answer, and their decision is penultimate.
Guys, before we continue, I need you to all rename yourselves accordingly to the team you are in. If you are in the Deltoid Daredevils, you just can put DD. And if you're in the Quad Squad, you can put QQ, okay? I mean, sorry, QS. But we need to see all of your team names in your name, please. So Amol, what happens if they don't comply with the rules? Like in this case, for example.
So failure to comply with the rules will lead to 3 warnings per round. And if they still don't comply, they will get a -1 for their team. And the warning would be the host's call or the organizing team's call.
Perfect. So Amol, you mean after 3 warnings per team, they're going to get a -1 point?
Yes, that is right. And anyone who creates a lot of disturbance will be given a warning. But if they still don't comply, it could result in removal from the challenge. So be careful there.
Yeah, be careful. Well, throughout the show, we will be posing several tricky questions to our participants who have arrived from different parts of the world to amaze us with their medical knowledge, purely based on their merits. Things will be tough, things will be interesting, and things will be thrilling. But most of all, Project IMG is eager to introduce the first ever winner of the USMLE Challenge. So guys, get ready to sit on the edge of your seats for the remainder of the show. And don't forget to grab your popcorn because this will be the best USMLE challenge you have ever seen.
So are you guys ready to witness history being made?
The first,
Can't
but
wait.
not the last, historical moment in Project IMG.
The USMLE Challenge Season 1. So let's get started with round 1, tetraplegia. Questions would be displayed to one team only. The other team will be sent to a breakout room. Round 1 will consist of multiple choice questions or MCQs. Guys, you know the drill. One big question, 4 confusing options, and amongst which only one is the correct answer. Each team will have 10 questions and answering time is 45 seconds.
Omar, this is reminding me of step 1, except for I didn't get to discuss it with anyone.
Yeah, so true. Here they have only 45 seconds to answer each question, and as explained earlier, only those displaying hands up emoticon can enter the discussion, and the team leader decides who answers. His or her decision is penultimate.
Omar, can you elaborate on the work of the team leader, please?
I will be assigning the team leader for each question, and his or her work will be to identify the ones who want to take part in discussion and assigning someone to answer. However, the leader himself or herself cannot answer the question, unfortunately.
What an irony.
I know 45 seconds seem long, but with this added challenge and the kind of questions we have, 45 seconds will seem to pass in the blink of an eye.
Omar, is there a signal for the team leader to identify if a person wants to enter the discussion?
The only time you're allowed to touch your computer or your mouse is the time that you want to click on that raise hands emoticon.
Omar, can you please tell me about the markings for this round?
If you answer correctly, you will get a +1. If the team could not answer, the question could be passed on to the next team, and if they answer correctly, they'll get +0.5 point.
Perfect. And what is considered as breaking rules?
2 participants speaking at once or speaking without putting the raised hand emoticon will result in a warning. Team leader answering the question will be considered as breaking the rules. Touching mouse or computer apart from designated time to raise hand emoticon will also be considered as breaking the rules.
Is there going to be a negative marking for breaking the rules?
-1. I'll give 3 warnings per round for breaking any rules from the team leader or the team, after which -1 will be done.
Perfect. Okay, guys, before we continue, I want to make sure all of you have your team names. So if the other host and team can help me checking that, please. I see Amarjot doesn't have the team name next to his
I'm
name.
having a problem with that. I don't know why it's not allowing me to change the. I'm trying, but I don't know.
Is this fine? I think.
Let me. Do you see someone else that doesn't have the name of the team? Omar, Amol?
No, I don't think so. I can see all of them.
Can you see my name now?
Yes, now it's working perfect. Thank you, Amarjot. Okay, guys, so to summarize, +1 for answering correctly, +0.5 for answering past questions correctly, and a negative 1 for breaking the rules on 3 warnings. Is that right, Omar?
Great, Rocio.
I was paying attention.
What happens in case of a tie, Omar?
Should a tie occur, 5 additional questions will be included as a rapid fire round. One player from each team will be chosen to tackle each question, and there will be 5 questions, and whichever team scores the higher points will win, just like in the football penalties. Okay, guys, so now since we are clear, guys, are you excited to start round 1, tetraplegia of the most awaited USMLE challenge show? Before we start this round, I would like to request our team to send team quad squad to the breakout room. Guys, okay. So,
bye, guys.
Good luck to
Bye.
all. May the force be with you.
Okay, so since the team quad squad is tied up in the breakout room now, we can commence this round by assigning the team leader for the first question. And for the first question, the leader from Deltoid Daredevils is Amarjot. Could we have the first question, please? Okay, a 31-year-old woman comes to the office for follow-up of bipolar disorder. The patient was diagnosed at age 19 following a maniac episode and has history of 2 hospitalizations at age 24 to 29 for a major depressive episode. Her mood has been functioning well. She hopes to become pregnant and would like to stop her oral contraceptive in the next few months. She says, I don't want to risk having another hospitalization, so I would like to keep taking medication during my pregnancy. After the discussion of the treatment option, the patient decides to stop valproate and switch to a different medication. Which of the following is the most appropriate treatment option for this patient? Could we have the options? And your time starts now.
Okay, so do my team know the answer? Yeah, so Janish Patel, you know the answer.
Your time starts now.
I think it is lamotrigine.
Okay, any other opinion? Hello.
Dr. Ravi, you're on mute.
Yeah. Can I contribute, right? I also.
Yes, go ahead.
I also believe the same.
Yeah, okay, good. That's the answer. Okay, good.
Okay, guys, so the time's up. The team leader has to decide who's going to answer the question.
Okay, it's Avi who will answer.
Okay, by consensus, I think we'd go with D, lamotrigine.
Okay, so let's check if D, lamotrigine, is the right answer or not. And the correct answer is lamotrigine. You got it right.
Oh, that's good.
Congratulations, Team Deltoid Daredevils. Yay.
Good.
Could we have Team Deltoid Daredevil sent us into the breakout room, and could we have the Team Quad Squad back?
So we have team quad squad now. Are you guys excited?
Yeah.
Yeah.
Okay, so the team leader for question number 2 is Javeria from Team Quad Squad. So Javeria, are you ready to begin?
Yes.
Okay, so could we have question number 2, please?
Yes, I'm ready.
Okay, so a 32-year-old woman comes to the OPD for evaluation of abnormal movements. The patient has been having involuntary facial grimaces and extremity fidgeting. She has no history of medical or psychiatric conditions. She had frequent anger outbursts over the past year. The patient takes no medications. She is a smoker and used illicit drugs for several years during college, but not since then. Her father died of a neurological disorder at age 55. Physical examination shows intermittent, fidgety, jerky movements of the hands. MRI of the brain of this patient most likely shows which one of the following? Could we have options, please? And your time starts now.
Hello, Kathan Pankaj, can you please answer?
I just want to confirm with Siddharth that we are going with D.
I go with option D, Kathan.
Go with D.
Sorry, what did you say?
Option D. Okay, guys, time's up. Team leader has to decide who is going to answer.
Kathan Pankaj will answer this question.
I will be going with enlargement of frontal horns of lateral ventricles.
Okay, guys. So we are going to lock D, enlargement of frontal horns of lateral ventricles. Let's check if that's the right answer or not. Okay, guys. So that's correct. Yay, Team Quad Squad. You are doing great. Quads are getting built. Okay, guys, I would request you to turn off the mic for your other device so that I could not hear my echoes. Okay, guys, so could we have Team Quad Squad sent into the breakout room and Team Deltoid Daredevils back? So we are going to start with the third question, and the team leader from Team Deltoid Daredevils is Arpit. Okay, so let's move on to the third question. Okay, so a 65-year-old woman presented to the primary care physician with symptoms of fatigue, dry skin, weight gain, hair loss, sensitivity to cold, lightheadedness, and weakness for the past few months. She also reports sensation of pins and needles in her feet. Physical examination revealed paler and decreased sensation to pinprick bilaterally and a positive Romberg sign. Which of the following is true for the condition the patient is having? Let's have the options, and your time starts now.
Okay, so I'll read out the options. Destruction of the cells present in the antrum of the stomach, increasing the MCV hemoglobin, and increased hematocrit. Oncocytic change in the thyroid gland with fertile cells, and increased risk of peptic ulcer due to hyperplasia of G cells. And options are 1, 2, 3, 1, 2, 3, 4, 3 only, and 1. So who all would like to come in for discussion? 15 seconds left. So now 10 seconds left. So anyone who have any clue also can come.
I don't think so. It's B, but yeah, other can be possibilities.
You think it's B? All of you? Avi, what do
Okay,
you say?
it's time up. It's time up. Team leader has to decide who is going to answer.
Okay, so I think I would ask Avi to consider Amarjot's answers as well and then give the final answer.
Yeah, so the people who've raised hand can discuss it, right?
The discussion time is over, sadly. So now it's time for you guys to answer.
Although I have a query, like last time the options were discussed and then the time started. This time we have to take the options during the time itself. So it took
exactly.
We have options during the time. That counts as the time.
Okay. So Avi, you can just consider Amarjot's answer and then give the final answer.
You don't have time to discuss. You just have to give the answer.
Yeah.
We would appreciate that, please.
Okay, so I would go with D, because he said like not 2, right? So yeah, D. One.
Okay, so you are going with D, delta?
Yeah.
Okay, so let's check if delta is right answer or not.
Defoid deltoid daredevils.
Okay. So that's unfortunately the wrong answer. Okay, guys. So we are moving on to the next question for Team Quad Squad. Could we have Team Deltoid Daredevils back into the breakout room, please? Okay, so we will go on to the fourth question. Let's have fourth question for Team Quad Squad. And the leader for this question will be Jose.
Okay.
A 17-year-old male came into the office with his father for a follow-up. He is previously seen due to an acid peptic disease. During his initial consultation, an ultrasound was done, which revealed an incidental finding of cholelithiasis. He is on active duty in the army, and he is scheduled to leave in 3 months for a tour to the Middle East. An elective cholecystectomy is advised by the physician. The patient agrees to the procedure, however, the father refuses. What is the best action of the physician? Okay, guys, your time starts now.
Okay. Kalika, Siddharth, and
Can we
Nida, discuss?
Yeah.
The answer, please.
Okay.
I think it's B.
Yeah, I think it's D.
I think
the answer
Elective procedure. So you do not. It's an elective procedure, and he's a minor.
I think it's B because
I think it's
military
B.
people can go.
Yeah, he's on military duty.
Can go for it.
Yeah.
Okay, guys, your time's up. So team leader has to decide who is going to answer.
Okay. The team say the letter B.
You are going with?
With the letter B.
B. And don't place yourself on mute, please. We are going with B as the answer. Let's check if that's right or not. That's the right answer. Congratulations, Team Quad Squad. So let's have Team Quad Squad sent into the breakout room and Team Deltoid Daredevils back. So let's start with question number 5, and leader for question number 5 is Avi from Deltoid Daredevils. Okay, and an infant presents with recurrent infections and markedly decreased lymphocyte count. Elevated levels of adenosine and deoxyadenosine are found in the serum. X-ray shows the virtual absence of a thymic shadow. The defective reaction in this disease is which one of the following? And this is the X-ray. Guys, your time starts now.
Amarjot, you are sure about what you know? Hashar?
Yeah, I think it's B, adenosine to inosine.
B, adenosine to inosine is what you think, right? Amarjot, do you agree?
I think.
Amarjot, you agree, right? Amarjot?
Yeah, quite yeah. So it's a
Okay, Bhavya, you agree to B?
inosine.
We are going with B then, right?
Yeah.
Aisha, you agree as well?
Yeah,
what I
adenosine.
Bhavya, do you mind going and giving that answer for everyone?
It's B.
Okay, we'll wait for the time. Yeah, I choose Bhavya
It's a formation.
Okay, guys, time's up. You have to choose
Yeah, we
contestant.
choose Bhavya to give the answer.
The option
Okay.
is B.
Okay, let's check if B is the right answer or not. B, adenosine to inosine is the right answer.
Good job, guys.
Congratulations.
Good job, guys.
Congratulations. Okay, so let's have Team Quad Squad back. The leader for question number 6 is Dr. Kalika. And we are going to have sixth question shortly. Okay. A chest physician performs bronchoscopy in the procedure room of the outpatient department. To make the instrument safe for use in the next patient waiting outside, the most appropriate method to disinfect the endoscope is by. Could we have the options, please? Your time starts now.
Guys, please raise your hands.
This is a tough question.
Yeah, from those nitty-gritty lines.
Can we discuss right now?
Yeah.
Yeah.
Have Javeria and Shruti discuss.
It could be second or third, I'm not sure.
No, it's the time's up. The time's up. Team leader has to choose who has to
I would
answer
have
the.
Shruti answer the question.
I'll go for
Okay.
B. Second option, 2% glutathione for 20 minutes.
Okay, let's check if B is the right answer or not.
Oh,
Yay, you got it right. The squad.
Congratulations.
Yeah, good job.
Could we have team squad sent into the breakout room, please? Let's go with the seventh question, and the team leader for Team Deltoid Daredevils is Dr. Aisha Firdaus. Okay, so a 40-year-old male came into the clinic for a 5-day history of rashes on his arm after using a new watch. He tells the physician that he recently immigrated from Korea 2 months ago. He is accompanied by his daughter. He tries to speak in English and makes gestures related to his complaint. His daughter helps to interpret what the patient is saying. The physician calls a professional interpreter via phone, but the patient refuses to cooperate. What is the best action of the physician in this case? Okay, guys, your time starts now.
Okay, guys. Okay, Hashir, right? Are you sure about this?
Yeah. I'm pretty sure that it is B. Tell the patient that a professional interpreter is ideal in this case.
I think it is A.
Okay, Bhavya, Haseeb.
Yeah, I think it is A. Because if like if a
Sorry.
daughter or if a daughter or son wants to interpret, then you can allow that.
Yeah. Also, we can't reinstate the same thing that he has already refused. So I think A.
Arpit, did you go there with that answer?
And the time is up, guys.
Yeah.
Okay, so I select Haseeb to answer the question.
The answer is A.
A. Seek the help of the daughter.
Yeah, let's check if that's the right answer or not.
Yeah.
Yay!
Yay!
Good discussion, guys.
Yeah, you're doing great.
Okay, so the leader for this question from Team Quad Squad is Muskan.
Okay.
A 30-year-old man comes to the physician for the evaluation of a painless right-sided scrotal swelling he developed a few weeks ago. The patient is a golf player. The patient has scrotal heaviness, which increases and makes him uncomfortable after prolonged standing and Valsalva. His symptoms decrease when lying down. He declines any scrotal trauma. Applying a bright light to the right hemiscrotum shows no transillumination. Which one of the following is most likely responsible for this patient's scrotal enlargement? Okay, so your time's up.
I guess Dr. Kalika and Siddharth can discuss.
I think the
I
option
think
is answer is
varicose
D.
vein. Yeah, it was, I think,
No, I believe it's failure of the processus vaginalis to obliterate because it's not transilluminant. So it would be an inguinal hernia. So I think the option is answer is D. Do you agree?
I think, or it can be a varicose vein question also. I will go with the.
Shruti, you can join the discussion.
I think it's right renal
Second.
vein obstruction. It's that tympani from plexus dilation.
I think second, I'm not sure.
Second.
Okay, you guys can go for it.
Javeria, please unmute yourself.
And guys, your time's up.
You are getting a warning.
Okay.
There's one warning for Team Cord Squad.
Second warning. For
So I'll ask Siddharth to answer.
This is the second warning for you guys.
Okay. So I'll go with B, second option, right renal vein obstruction.
B, right renal vein obstruction is your answer? Confirm? Okay. So we will go with B, right renal vein obstruction, and let's check if that's the right answer or not. So could we have the answer, please? Oh, that's incorrect. So let's move on to the 9th question. And the leader for the 9th question is Bhavya. So let's have the 9th question, please. You have isolated pure culture of an unknown species of bacteria and have detected high amounts of diaminopimelic acid, DAM, and N-acetylmuramic acid, NAM, during assessment of cell wall components. What color would you expect these bacterial cells after the decolorization step in Gram stain? Could we have the options, please? Yes, guys, your time starts now.
I think it's mycobacterium, but I'm not quite sure about.
Please raise your hand.
Yeah,
Okay.
it does.
Avi,
It does.
It's after, and Amarjot you can discuss. It's after
Yeah.
decolorization.
Anyone who else wants to come in the discussion, I think it is they're referring it to being acid fast. So
Okay,
Isha, Arpit, both of you can discuss as well.
So even I'm thinking because like.
But why would we do gram stain and acid fast?
No, we do. Acid fast refers to that they are not changed by gram stain, basically.
5 seconds, guys. Consensus.
Okay. So are we going for red, pink, or purple?
So I'm not sure about this.
Okay,
Crystal Valley, it's
guys,
either
your
purple
time's
or
up.
clear. It's either.
Time's up. Time's up. So Bhavya, who do you nominate to answer?
I think Dr. Ravi was sure of what he was saying. He sounded confident, so you can go ahead.
I was sure about the logic. I don't know what
Okay, guys, please give us the answer.
I would want to go with D. Yes, D. I'm pretty sure. Okay.
D as in Delta?
Delta. Fingers crossed.
Okay, so we would be going for D. Let's lock it and check if that's the right answer or not. Oh, you got it wrong. So sorry, Deltoid Daredevils. So the team leader for next round is Jose. Let's have the 10th question.
Okay.
Okay, a 22-year-old woman comes to the physician to discuss the prescription of an oral contraceptive. She is sexually active with her boyfriend and has been using condoms for contraception. Physical examination shows no abnormalities. Her medical history is unremarkable and takes no medications. She is prescribed combined levonorgestrel and ethinyl estradiol tablets. Which of the following is the most important mechanism of action of this drug in the prevention of pregnancy? Could we have the options, please? And your timer starts now.
Oh, okay, guys. Somebody know? Please, Muskan, go ahead. And Javeria, go ahead. And Siddhar, go ahead with the answer. Discussion, please.
I think it's A.
Yeah, I think also. It's basically
Inhibiting.
feedback inhibition. I'll also go with A.
Yeah, it's A basically because it doesn't allow eggs to be. Yeah.
Okay, so the time's up. Jose, who do you choose to answer?
Muskan, okay.
Okay. I like to go with A. Inhibition of rising.
A, let's check if A is the right answer or not.
Are you guys sure?
A is the right answer. Yay, quads are being built. Not in the gym, but at the USMLE challenge.
It's the only exercise we're getting. Yeah.
Yeah.
Okay, so could we have Team Deltoid Daredevils back for our next game? We will begin with the 11th question, and the leader for the 11th question is Hasib. And let's have the 11th question. A 5-year-old girl is brought to the emergency department with a fever of 39.4 degrees Celsius or 103 degrees Fahrenheit that has lasted 5 days. The mother says her child's lips have become severely cracked and she has been unable to eat well. The mother also is very concerned about her child's hands and feet being very red as shown in the picture. Physical examination reveals severe conjunctivitis and cervical lymphadenopathy. Which of the following is a dangerous complication that can result from the girl's acute disease? Should we have the options, please? Guys, your timer starts now.
I think it's a coronary aneurysm because of Kawasaki disease. That's my opinion. So yeah, that's my opinion.
Also, the fact that it had been written dangerous complication of the acute disease. So the complication is not necessarily acute. So I think C makes most sense if everyone agrees.
Are we sure that it is Kawasaki and not hand, foot, mouth?
No, absolutely sure.
Strawberry tongue.
Kawasaki.
Okay.
Yeah, it's Kawasaki. Hand, foot, mouth. There must be some vesicles which was not there.
You can choose anyone who says C.
Okay, so the timer's up. Guys,
yeah, I think it's
Hasib, choose your contestant.
Amazon, can you go ahead and answer the question?
Yeah, I will choose coronary aneurysm.
Okay, let's check if C, coronary aneurysms, is the right answer or not. Okay, C is the right answer. Congratulations. So the team leader for question number 12 is Nida from Quad Squad. So we are going with question number 12. A 28-year-old man comes to the emergency department with complaints of 1 to 2 days of fever, malaise, cough, green sputum production, and dyspnea. He is a cigarette smoker and works in a restaurant. He has no significant past medical history and takes no medications. He is uncomfortable but alert with temperature of 39.2 degrees Celsius, respiratory rate 28 breaths per minute, blood pressure 110/70, heart rate 105 beats per minute. Saturation on room air is 94%. His Chemistry studies are normal. White blood cell count is 15,500 per liter. There are bronchial breath sounds in the right lower lobe, and chest radiograph shows consolidation in that area. Which of the following is the most appropriate antibiotic therapy? And guys, your timer starts now.
Yeah, I think Siddharth Javaria can discuss, as well as Hosek. Yeah.
I think it's a pseudomonas infection. So for me, I think it is fourth. What about others? Jose and Javier.
Kalika, please join in.
Strep pneumonia?
I think it's strep pneumonia, so I think it should be.
Yeah.
Yes, it's beta.
It should be?
B.
Ceftriaxone plus clarithromycin.
Ceftriaxone.
B.
Yeah.
Yeah, broad spectrum. Correct. Okay. So I'll go with B.
Yeah, the B.
Okay, guys, so the time's up. So Nida, who do you
So
nominate to answer?
I pick Javaria.
Answer is B. Ceftriaxone plus clarithromycin.
Okay, we are going with B, ceftriaxone plus clarithromycin. Let's check if that's the right answer or not. Oh, unfortunately, that's not the right answer. The team leader for 13th question is Jenish. Jenish, are you ready with the question? Let's go on with the 13th one. A 69-year-old homeless woman presents to the pulmonologist with a history of with the sudden onset of productive cough, shortness of breath, and high fever for 1 week. She denies consuming alcohol, drugs, or tobacco. X-ray of the chest shows a large left lower lobe opacity. Which of the following antibiotics would be best initially to treat this patient's infection? Guys, your timer starts now.
Have any idea?
For homeless, I think it can be TB, but it's lower
You
lobe,
are
so it can't be.
speaking without raising hands.
Amar, raise your hand. Yeah. So
that's
homeless,
not
but
the
I
best
don't
enough.
think so. Suddenly high fever doesn't sound like TB.
Lower lobe strep pneumo. What do you
Yeah,
think?
more probability.
Community acquired
Because
pneumonia.
lobar pneumonia.
That then ceftriaxone will go, right?
This no way should be aspirational, right?
No.
It can be, but there would have been history of alcoholism.
So let's
gonna
No,
So it was
ceftriaxone.
negative.
Ceftriaxone works for everyone.
Yes.
Guys, timer's up. So, Jenish, who you have chosen to answer?
Dr. Ravi, please go ahead.
Consensus, everyone. I think community acquired pneumonia. A, ceftriaxone.
Okay, let's check if A, ceftriaxone is the right answer or not.
Are you guys sure?
I'm nervous.
Confusing with.
I want to see the
erythro.
answer.
Yeah.
Oh,
You
good.
guys got it right.
Great, man.
Good job.
Yeah.
We're going head to head.
Yeah, congratulations, Team Deltoid Daredevils. The team leader for 14th question is Dr. Shruti Jain. Let's begin with the 14th question. Starts now. Guys, could we move on to the options? Guys, your timer has started.
Yes, Siddharth was it.
Jose, it's I'll
B,
go.
I think.
Yeah, I think I will go with the last option. What about else?
CT scan, yeah. I will go with that.
The last option.
Interstitial lung disease, I think. Okay. So I think
Yeah.
we're good with D.
You guys can still discuss. You have 13 seconds left.
Yeah.
No, you want to echo, you want to angio, bronchoscopy is too
echo can
invasive for
be
the
done
first
for
one.
AFib in this time, but
Stop. The time's up. And Shruti, would you choose to answer?
Yeah, Jose, can you please answer the question?
Okay. The letter D.
D as in HRCT.
Yeah, the letter D.
Delta, right? Okay. Okay. So, okay. We'll go on with Delta. We'll check if D is the right answer or not. Yay! Congratulations. The team leader for the 15th question is going to be Hashir. And let's have the 15th question. A 77-year-old man presents to his primary care physician for a routine wellness check. Upon a review of systems, the patient's only complaint is shortness of breath. Social history is significant for a 50-year smoking history. On physical examination, his vital signs are within normal limits, except for his blood pressure, which is 170 by 95 millimeters of mercury. On his previous visit, his blood pressure was 155 by 90 millimeters of mercury. His physical examination is also significant for the condition of his hand shown in the image, as well as wheezing on pulmonary examination. Good. Okay. Which of one of the following antihypertensive agents is relatively contraindicated in this patient? And your timer
Okay,
starts
so
now.
George, you raise your hand. Which one do you think is the answer?
I think bisoprolol, because beta agonist can cause vasoconstriction. So
Thank you, Dr. Avi.
Oh no, it's a nadolol because
I think ACE inhibitors are contraindicated. I think, but this is scleroderma renal crisis, right?
Yeah.
Not B, not D. They are fine. Amar, have you read somewhere, or are you just thinking?
I think it's a Raynaud phenomenon.
I
that's
think
why
it's a Raynaud phenomenon, and any beta antagonist would be contraindicated. So nadolol or bisoprolol. Bisoprolol has partial alpha agonist, right?
Yeah.
So
Yeah.
D should be the answer.
Okay, timer's up. Who's going
So
to
I
answer?
nominate Arpit for the answer.
Arpit, okay. Arpit.
I nominate Arpit for.
Okay, from the team's discussion, I think we'll go with the option D, nadolol.
D, nadolol. Let's check if nadolol is the right answer or not. Congratulations.
Good call.
So good, so good, so good.
So we will be going for the 16th question, and the leader will be Siddharth. A 40-year-old woman comes to the physician because of a 5-week history of hoarseness and difficulty swallowing. She also has a history of lower back pain treated with over-the-counter medicine. She is 162 centimeters, 5 feet 4 inches tall, and weighs 77 kilograms or 169 pounds. BMI is 29 kilogram per meter square. Her pulse is 64 per minute and blood pressure is 130 by 86 millimeters of mercury. Physical examination shows dry skin, swelling of the lower extremities, and a hard, fixed, non-tender anterior neck swelling that does not move with swallowing. Femoral and pedal pulses are decreased bilaterally. A biopsy of the neck swelling is most likely to show which one of the following findings. Let's move on to the options. Your time starts now.
Yeah, Nida, Kalika.
I'm thinking non-caseating granuloma.
Yeah, me too. Sarcoidosis, right?
Sarcoidosis. That's what I was thinking. This is not thyroid. Yeah.
No. Collagen is ruled out. I think it's not. Yeah, and it's not medullary either. That's A.
No.
So I think we should go with C. Muskan, what do you think?
I think it's C.
Okay, time's up.
So Kalika, you can answer.
Okay, so I'll go with C, non-caseating granulomas.
Okay, let's check if C non-caseating granulomas is the right answer or not. Oh, sorry, you got it wrong. It's B, collagen deposition. So sorry, quads. Okay, so let's go on with the 17th question, and the team leader for 17th question is Aisha. Okay, a 45-year-old previously healthy man is brought to the ER due to headaches and confusion for 2 days with no focal weakness or sensory symptoms. The patient has no significant past medical history and does not take any medications. He does not use tobacco, alcohol, or illicit drugs. Temperature 100.2 degrees Fahrenheit, blood pressure 140 by 86, pulse rate 96 per minute, and respiratory rate 16 per minute. Mild icterus is present. His neck is supple and without any rigidity. Neurological examination shows no focal deficits. Lab reports hemoglobin 8.4 grams per deciliter, WBC 5500 per liter, platelet 44,000, BUN 30 milligrams per deciliter, creatinine 2.2 grams per deciliter. A peripheral blood smear shows fragmented red blood cells. The prothrombin time is normal. Which of the following is the most appropriate next step in the management of this patient? And your time starts now.
Okay, Amarjot, what do you think?
I think it's a cryoprecipitate or plasma, one of two,
Dr.
because it's a
Avi?
TTP.
I think it's a clear case of TTP. So
Yeah.
in that case, the hemoglobin was 8.4, not less, right? It was 8.4, right?
Yes,
So
8.4.
Yes.
that does not require transfusion. I think pretty sure it's plasma exchange. Like I'm 95, 98, 99.
Yeah, I
Arpit
also
and
say the
Bhavya, do
same.
you
But
agree?
it said next step. So won't we go for
Yeah.
cryoprecipitate to stop the bleeding
Yeah,
first?
why are we ruling out that as a first step, cryo?
Yeah.
Cryo, we don't.
think
I don't
cryo.
think so. Cryo
It's
will
for
not
Von
help.
Willy brand also.
Yeah, it doesn't help.
It can
It doesn't
be.
help. It doesn't help.
I'm not sure. B can be also the option.
And your time's up, guys. So
Okay, Dr. Ravi.
I'm pretty sure I would want to risk it with plasma exchange.
Okay, let's check if plasma exchange is the right answer or not. Plasma exchange is the right answer.
Congratulations.
can we have team quad squad back, please?
So we have question number 18, and the leader for this question is Javeria from Quad Squad. A 55-year-old woman with a long history of hypertension and mild rheumatic mitral stenosis comes to the emergency department for severe skin changes. She was recently diagnosed with atrial fibrillation and was initiated warfarin therapy by her physician. The patient's other medications include hydrochlorothiazide and metoprolol. Skin examination shows necrotic black colored changes with edematous and pruritic areas. A cardiac examination reveals faint mid-diastolic murmur. The rest of the examination is unremarkable. Which one of the following is the likely cause of given presentation? Your time starts now.
Wow, that was fast.
Protein deficiency.
Kalika, Shruti, and Siddharth, can you please discuss the question?
Warfarin syndrome?
Warfarin skin necrosis.
Protein deficiency.
Yeah. Yeah. Protein. Yeah.
Third and fourth, I think they are not like it inhibits 2, 7, 9, 10 only.
Yeah.
So
Protein
anti-
CNS, right?
yeah. So
CNS get depleted fast. So
So B, I think we can go
B,
with
yeah.
protein deficiency.
2, yeah.
Okay.
Kalika, please answer the
So
question.
the time's up. Who do you choose to answer the question?
Kalika, please answer the question.
So we'll go with option B, protein deficiency.
Okay. Let's go with B, protein deficiency. And what do you think is the right answer? B, protein deficiency is the right answer. Okay. So let's go on with question number 19.
Yeah, I think we have them all here.
Okay. So the team leader from Deltoid Daredevils is Bhavya. And the question is, a 19-year-old man is brought to the emergency department due to weakness and confusion. Family members report that for the last 2 weeks he has experienced polyuria, polydipsia, and increased appetite. Medical history is remarkable for an appendectomy at the age 12. The patient does not use tobacco, alcohol, or illicit drugs. Family history is significant for hypothyroidism in his brother. Temperature is 36.7 degrees Celsius or 98 degrees Fahrenheit. Blood pressure is 90 by 60 millimeters of mercury. Pulse is 97 per minute and respirations are 22 per minute. On physical examination, the patient is lethargic but follows simple commands. His breath has a fruity odor. This patient is most likely deficient in a hormone that normally performs which one of the following actions? Okay, so the team leader for question number 20 and last question is Muskan. And let's go on with question number 20.
Hands, guys. Please make sure your hands are up.
A 59-year-old male is hospitalized for acute inferior wall myocardial infarction. He has decreased cardiac output with hypotension requiring multiple medications. His urine output drops over the next 4 days. His serum urea nitrogen increased to 62 milligrams per deciliter, with a creatinine of 4.3 milligrams per deciliter. Urinalysis reveals no protein or glucose, trace blood, and numerous hyaline casts. 5 days later, he develops polyuria and his serum nitrogen returns to the normal range. Which of the following pathological findings in his kidneys is most likely to have caused his azotemia? Could we have the options? And your timer starts now.
Okay, Siddharth. Anyone else is there? Okay, Dr. Kalika and Siddharth, you can discuss.
Kalika, I think it's a pre-renal.
Shruti?
Yeah, pre-renal.
So it
So-
can't be D or A. And
But B is interstitial necrosis, that can't. That's
Yeah,
renal.
A can also occur, renal papillary necrosis or no?
That will be granular cast, I think. That's not the answer.
Can it, it can't be C, neutrophilic infiltration.
Are we going for B or D?
D, I think. Can it be acute interstitial necrosis?
D.
Jose, your hands have to be visible.
Okay.
Okay.
So I'll just go with Shruti.
I'll go for D, patchy tubular necrosis.
Okay. So which answer are you going with?
D, patchy tubular necrosis.
Okay, let's check if patchy tubular necrosis is the right answer or not. Patchy tubular necrosis is the right answer. Congratulations. Team Deltoid Daredevil scored a total of 6 points, and the Quad Squad scored a total of 6 points as well. So,
Oh my God.
who said that there was going to be a tie?
Babja.
This is so cool.
Okay, so now we are heading towards a tiebreaker. So I will repeat the rules for the tiebreaker again. So you have to choose 5. So each team has to choose 5 participants for 5 questions, and 1 participant from each team will be coming forward to answer question. For example, we take an example like Muskan is coming from Team Quad Squad and Bhavya is coming from Team Daredevils. So you both, there will be no discussion during the tiebreaker, and you don't have to raise your hands virtually. It has to be your actual hand raised like this. Okay, and it has to be visible to the camera. Okay, and it's going to be a series of 5 questions. So whoever scores the higher scores wins this round. First one to raise hand will answer, and if wrong, it will be automatically passed on to the next team. So we are going with Shruti and Amarjot. Let's have the first tiebreaker. A 30-year-old man visits your clinic for yellowing of skin and sclera for past 1 week. The patient also expresses concerns regarding yellowing of skin 2 to 3 times a year following a flu since childhood, but it subsides on its own. He says one of his maternal uncles also had a similar problem and died of liver failure. You order a liver function test and find direct hyperbilirubinemia but normal liver transaminases. Urine coproporphyrins are normal. The gross appearance of this patient's liver will be like Shruti raised her hand first.
Yeah, she raised her hand first.
Shruti raised her hand first, right?
Yes.
Okay, okay. Shruti.
I'll go for B. B for
B.
bad, second option.
Okay. Let's check if B is the right answer or not.
Yes, congratulations.
Congratulations, Shruti and Team Quad Squad. So let's go with tiebreaker number 2. A 26-year-old man is attempting to improve his performance as an amateur weightlifter. To this end, he purchases a bottle of lysine supplements at a health food store because he has heard this will help build muscle tissue. To speed up his progress in training, he takes 10 times the amount of lysine recommended on the container. After 4 weeks, he presents to the physician with skin rashes, intestinal discomfort, and general lethargy. After learning of the lysine supplements, his physician notes that the symptoms may be due to negative nitrogen balance. An elevated level of BUN, blood urine nitrogen level, supports this diagnosis. The excess intake of lysine was likely impairing the intestinal absorption of Avi.
Avi. Yeah, Avi.
Yeah, phenylalanine and tyrosine.
Muskan, what do you think is the right answer?
Okay, I was thinking about going with B. Aja.
Perfect. Let's see if Abhi gets the right answer. Oh,
Okay. So team Quad Squad got the point, right?
yes.
Yes. Congratulations.
So let's start with the question. Do you guys want to practice your hands up?
Shagreen patches are seen in which disease condition?
Come on, man.
And let's move on to the option.
Okay, that was really close.
Yeah. What do you think, Amol and Rusio?
I think Arpit was like just by a millisecond. I think it was Arpit.
Yeah.
I think
Yeah,
we need
it was
an
happened.
empire's opinion. Could we get a third empire's
I
opinion?
lost. You can check the recording I have.
Yeah, we're just gonna check it.
Yeah. You can check it.
Okay.
Arpit.
Okay, can I answer? I would
Yeah,
go
so
with C, tuberous sclerosis.
Tuberous. And what about you, Siddharth?
it's C, tuberous sclerosis.
Okay. So let's check if C is the right answer or not. C, tuberous sclerosis is the right answer. Well done, Arpit. Let's move on to question number 4. A 16-year-old boy is hospitalized due to 1 week of persistent fever, dry cough, and weakness. Physical examination shows diffuse lymph node enlargement, mild hepatosplenomegaly, and scattered petechiae on the extremities. Testicles are normal and there are no neurological abnormalities. The boy was diagnosed with acute lymphoblastic leukemia for which he received cytotoxic chemotherapy. Lab reports are as follows: elevated potassium levels, elevated phosphate levels, and increased lactate dehydrogenase levels. His urea and creatinine are elevated. The doctor tried giving a recombinant enzyme rasburicase. Does this enzyme convert urea into which one of the following easily excreted compounds? Could we have the options?
So Aisha definitely.
Aisha.
Okay, so the answer this is I'll go with A, urobilinogen.
And what about you, Kalika?
I would go with A, urobilinogen.
Okay. Let's check if nobody got it right.
I think Dr. Kalika realized that she was.
Yeah, I was gonna say C.
Okay, and we will have the questions shortly. Are you excited, Nida and Hashir? You are representing your teams for the last.
Yeah,
I hope I'm up to that.
A 52-year-old patient with diabetes mellitus is admitted with an acid-base imbalance. His arterial blood gas test revealed pH 7.36, partial pressure of oxygen 98 millimeters of mercury, partial pressure of carbon dioxide 33 millimeters of mercury, bicarbonate levels 18 milliequivalents per liter. Which manifestation should be identified as a compensatory mechanism? Nida, I think. What about you, Amol and Rusia?
Yeah, Nida definitely did it first.
Yeah, Nida was faster.
Hashar,
I would go with D.
B. And what about you, Hashir?
D.
D as in delta?
Yeah.
Yeah.
Yes,
Okay,
D,
and
D as in delta.
okay, D as in delta, both of you. Okay. Let's check what's the right answer. Yay! So Team Quad Squad got it right. Congratulations, Team Quad Squad.
Congratulations.
So how do you find the results, Amol and Rusio?
I think it was really close. Like I did not know till the end who was gonna win.
Yeah, me too.
Okay, so Team Quad Squad has won. Congratulations.
Congrats, guys.
Okay, so I am going to explain. As we know, Team Quad Squad has won, and we will be going into 8 versus 7. So the team with 7 participants has won, right? Okay, so so one member from the losing team will be chosen to join with the winning team, so that the quantity of the winning team members becomes 8, and we could divide them into 4 into 4 and then 2 into 2. So let's see who that one person is going to be. Okay, could we have our event management team let us know about who is it going to be, or about the criteria?
Okay, sure. Hey guys, so the show's been going really amazing. So regarding the current situation right now, since there's going to be 8 versus 7, and the original rules of the game is going to be 8 versus 8, 4 versus 4, and 2 versus 2. And the Quad Squad team has been playing with only 7 members. One of the participant had left in the middle of the game. So what's going to be happening right now is, as I said, it's going to be something special and maybe a bit challenging. So a question would be displayed, a magical question would be displayed. So the 8 participants from Team Delta Daredevils will be given a chance to answer it. And the first one to answer it, it's going to be a rapid fire one. And the first one that's going to be answering it wins a round and gets promoted to the next round. So that's how.
Is there going to be a raised hand in this as well, just like the tiebreaker, right?
Regarding that, maybe since it's going to be special, I'm going to be leaving it to the team to discuss. So I'm leaving it to the team to discuss if they want to have a raise hand or raise hand, via Zoom or manual.
Okay, so we are ready with the special surprise question for Team Deltoid Daredevils. And could we have the surprise question, please? Okay. So a 35-year-old female came to the office with the complaint of painless midline neck swelling, dysphagia, and painless cervical lymphadenopathy. On palpation, the swelling is firm in consistency. There is a history of exposure to ionizing radiations in the childhood. A biopsy was done and it revealed the concentric lamellar calcifications. The given condition is associated with which mutation?
So I see that Arpit answered first in the chat. Is that the same for everyone?
Yeah. Even I see Arpit answered first.
Yeah, it's the same for all.
Okay. So let's see if that's the right answer or not. Arpit went with A, and the correct answer is B. So
Avi was the first one to answer B.
yeah, congratulations, Avi. You will be joining. You will be moving on from the upper limb to the lower limb and joining Team Quad Squad. Sorry, team.
Say one line before that, Omar.
Yeah. Sure.
I'm gonna be representing all 8 of us. So it's your everything, whatever. So thank you.
Okay, congratulations, Team Quad Squad and Avi. Team Deltoid Daredevils could stay tuned to us via YouTube. Keep enjoying, guys. Have a good night and watch our show as well.
Guys.
All the best.
Or breakfast.
All the best. Good luck.
All the best.
Okay, guys. Amol, what do you have going on in your mind right now? Let's ask Amol what she has going on in her mind right
I'm
now.
really excited for the next round because it's a really interesting round. So I'm just waiting for the participants to be divided into their new teams.
Okay, so let me announce the new team divisions. So from deltoids, we will be moving on to the forearm. So they will be cleaved into four. So it will be fibular fighters versus tibial titans now. So in fibular fighters, Javeria, Jose, Kalika, and Avi are the fibular fighters. Woohoo!
Woohoo! Come on, guys.
And please change your names again to the new teams you're in.
Yeah, you can put FF, fibular fighters.
And Muskan, Nida, Shruti, and Siddharth are the tibial titans. I will request them to change their names accordingly. And if anybody has a confusion regarding the team name, they can ask me now.
Yes. Fibular fighters, FF, tibial titans, TT.
How do you feel about the division? We have moved on to the forearm. Amol and Rocio?
I think we divided the quad squad into fibular fighters and tibial titans now, so we didn't move into the forearm.
Oh, yeah. Sorry, my anatomy got messed up. But my team won. Quad squad won. What about you? How are you feeling?
We're going to win.
Omar's excitement was more than ours.
Yeah.
So X was greater than Y?
For now.
Okay, so I think Amol, we are ready to start.
Yes.
Are all the team members here?
Yeah, I'll ask you to turn your cameras again, please, all of you.
Yeah. I'm gonna just announce the names once and make sure everyone's here. So
And Vaishnavi has slides.
Sorry?
Slides. Vaishnavi has could.
So for the fibular fighters, we have Javeria.
Yes, I'm here. Yes, I'm here.
Yeah, we have Jose, we have Kalika, and we have Avi, right? So fibular fighters are all here. For team tibial titans, we have Muskan.
Yes.
We have Nida. We have Shruti, and we have Siddharth, right? Is everyone here?
Yeah, they're all here.
Siddharth's here.
Oh, we're missing. Yeah, he's here.
Everyone's here. So we're going to move on now. So participants, you're going to be investigating a mysterious case now and escape the room before it's too late. Hosts, do you think our contestants have the skills to unlock 5 puzzles in 6 minutes and escape this room?
Definitely.
So welcome to the Deficit and Diagnose to Escape round. Just like an escape room challenge where you solve puzzles and escape the room, our contestants too will be locked up in this challenge and will need to successfully solve 5 puzzles in 6 minutes to escape the room and move on to the next round. I'll be first displaying the questions and I will not tell you how many clues there are. Once you get all the clues in the crossword, I will inform you that you found them all and you can move on to figuring out the diagnosis. And only upon solving the entire crossword correctly can you move on to the next crossword. The points will be as follows. For finding out all the keywords in the crossword, you'll have 1 point. And for figuring out the correct diagnosis, you'll have 1 point. And the first team to score the highest score in the designated time will escape this room and into the final round.
So Amol, are there any ground rules for this round as well?
Of course. Make sure to put your hands up to answer. Failure to cooperate will lead to a warning and a -1. If a tiebreaker occurs again, there will be 3 rapid fire rounds of crosswords and only 1 member will be stepping up and solving each of the challenges. Again, the first team to solve the crossword and find the diagnosis will win. So we already have the teams divided, right? First, we'll have team fibular fighters who are going to answer. So till then, team tibial titans, please move into your breakout room. See you guys soon. I would also request Omar, please keep a 6-minute timer with yourself.
Yeah, sure. I'll be doing that. And should I let the participants know after each minute so that you will let know? Okay, sure.
Omar will be announcing after each minute.
Okay,
So
you will be.
then I would like to ask Kalika, with whom or what are you most scared of being locked in a room with?
Oh my God. I'm scared of being locked in a room per se. I don't like closed spaces. But if I had to be locked up with someone, I think the Joker from Batman. Don't want that. Really don't want that.
That was an interesting answer. I did not expect that. So, okay, moving on to the next round. I would request our challenge team to please display the first crossword.
Can I ask a question just before you?
Yes,
so
please.
How many crosswords are there for the 6 minutes?
5 crosswords.
5 crosswords. Okay. And how are we supposed to like figure out the clues, ask questions?
No, you're supposed to look at the crossword and find the clues. And the clues lead to a diagnosis. So you're supposed to figure out the diagnosis. So once you find all the clues, I will inform you that you found them all. So you found the diagnosis.
Can I ask a question?
Yes.
If we are not able to diagnose a disease, can we move to the next crossword?
No, you cannot. You have to solve it correctly to move on. So it's like an escape room. You do not get the key if you don't answer the question.
Also, Amol, like, is it 1 mark for all the clues together and 1 mark for the diagnosis?
Yes.
So in total, it is 5 into 2, 10 points max.
Perfect. So, Omar, are you ready with the timer?
Yeah, I am.
And contestants, are you guys ready for your first crossword? Okay, can we have the first crossword, please? And your time starts now.
Ataxia.
Splenomegaly. Lumbar.
Are they also diagonal or only horizontal, vertical?
There could be any way.
Splenomegaly.
Come on, guys, you guys can find it.
One minute's up.
Hurry up, guys. 1 minute's up.
Come on, guys. I know you can do it.
You can even discuss it amongst yourselves if you want.
Is anyone looking diagonally?
I'm assuming at least they have a few more horizontal and vertical. We can't be so bad.
Is fail a clue? I don't know.
You found splenomegaly, right?
Yes. Yeah, we did.
Yes. And ataxia as well.
We found
4 minutes left.
Sepsis.
Okay, so splenomegaly is the right clue, but the rest of those are not.
Whoa, okay.
Berry.
Yeah, I was going to say berry.
Yeah.
Berry is not the right clue.
Why do you have wrong words in there?
Exactly. Wait, do we have 6 minutes for the entire crossword or 5 of them?
The entire 5 crosswords.
Oh my God.
So you guys gotta hurry.
Two minutes and 50 seconds left.
Oh my God.
Tick, TIC, tick.
Kalika, try find E. coli. I don't know if like
I don't
but
think they will. Yeah, but no, there's no E. coli.
something relevant to splenomegaly, at least. Maybe CLL or something.
Cell, CELL, foam cell. I found foam cell.
Yes, foam cell is the correct clue.
Did you find it diagonally?
No.
Yeah.
It was vertical.
So you have foam cell and splenomegaly.
It's a glycogen storage disorder, right? So let's find
Come on, guys.
or hunter. Something.
So I just want to give you guys a hint. There's no diagonal.
Now the other team knows we've wasted enough
This is
time.
wrong.
1 minute and 32 seconds left.
LEUC, sorry, LEUK, Luke. There is nothing after that. It's just Luke.
Cherry.
Yes, cherry is the correct. Cherry red is the correct clue. One more clue left.
One
I think I then, I don't know.
eye cell disease, one girke, hurler, hunter, cataract.
Can't find any of that.
Oh, what's the name?
45 seconds left.
Syngomyelin or Niemann-Pick.
You guys need to decide and let me know which one you're picking. But
Oh,
you
all of
haven't
those.
found all the clues yet.
All of those. I've said those words. Yeah.
So you get the correct point for Niemann-Pick.
Yeah. Cool enough. Yeah. Okay, 1 point.
You still haven't found all the clues.
Splenomegaly. Neuropathy. Oh, I don't think so.
9 seconds left.
Hepatomegaly.
Perfect. You guys get another point. Can you please go to the next one?
Time up. Time up.
So you guys got 2 points. That was great. It is a very challenging.
Wow, that was great.
We were trapped in there.
At least we have something to defend.
Yeah, I was worried we weren't gonna get anything at all.
No, but you guys did great. This is a very challenging round.
Yeah, true that.
Yeah.
It was fun.
Good job.
Also, you guys got a couple of hints which could or could not apply to the next team because I gave you guys a hint so that you guys would move faster.
What hint did you give us?
That there's no diagonal.
Yeah, so tell them after 3 minutes. Okay.
It's not for every round, like crossword, right?
Okay. Got it. Fine. Yeah. But whatever the hint, give it after 3 minutes. Once they start feeling anxious about it.
Perfect.
Yeah, sorry.
Okay, so can we please have Team Tibial Titans back? And they can ask Team Fibular Fighters about their experience.
Yeah, but not telling anything else.
Let's just lie. We did so well.
Oh, we did great. We got 10.
We actually did. Like we were like, this used more brains than the last 2 hours. Yeah, there's so many breaks.
So Team Tibial Titans, Team Fibular Fighters did really well. And they'll be moving into a breakout room. So now Team Tibial Titans, are you guys ready?
I just wanted you to clarify some rules again, like if you could. Yeah.
So, we were asking, the questions are going to be same, the ones you ask them, or they're different?
They're different.
Okay, and are we allowed to discuss amongst us? Like,
Yes, you're allowed to discuss it, but please don't make it chaotic.
Yeah, sure.
And what actually it is? It is going to be a paragraph, or what it is, I think.
It's a crossword puzzle. So you'll be solving the crossword, you'll be finding clues in the crossword puzzle. And then on the basis of those clues will lead to a diagnosis. Then you'll be telling me the diagnosis, and only when you get the correct diagnosis and all the clues will you be moving on.
Okay, and we have 6 minutes for all the crosswords, right?
For 5 crosswords.
And for example, I have a first puzzle, and we sequentially, after discussion, we are giving you the clues. So you will side by side confirm it, like this clue is correct or not.
Yes.
Okay.
As soon as we say the word out loud, you would be telling us if it's the right answer or not.
Yes.
Okay.
Okay. So it's just like a guess also. We can also guess, but it's nothing negative over there. Okay.
So, Omar, are you ready with the time?
Yeah, I am. 6 minutes.
Yes. Can we have the next set of crosswords, please? And your time starts now.
Sepsis?
No.
Peniloma.
Perfect.
Disorder. There's a disorder here.
Nope.
Oh.
Five minutes up.
They have only 1 minute left.
Sorry, 5 minutes left, I said.
Okay.
I just gave them a heart attack.
Hurry up, guys.
I could feel their excitement or nervousness.
Finiloma.
You've already found that.
Oh, sorry. I didn't hear that. Sorry. Fever.
Nope.
Siddhant, can you just do it horizontally? Me and Muskan will search words vertically.
Yeah.
Muskan, take the left side. I'll take the right side.
Okay.
Siddharth, you do the top. I'll do the
4 minutes left.
Okay, sepsis isn't it, right?
Sepsis is there, no?
Yeah.
Order.
But it's not the option.
Fever.
Nope.
Yeah, I said fever.
Okay.
I'm getting nervous in these rounds. They're so challenging. Come on, guys. Focus up.
You can do it. Angel is with you as well.
Stroke.
Yes.
Oh, they're upside down too. Oh my God. Okay.
2 minutes and 20 seconds left.
C disorder. Is it something C disorder? Okay. Or just disorder?
1 minute and 30 seconds left.
Hurry up, guys.
Age. No. Is there age?
Is there?
No.
So I'm going to give you a hint. There's nothing diagonally. They're only straight.
Oh, okay.
As in vertically and horizontally both. Right?
Yeah, vertically and horizontally, but not diagonally.
And how many
35 seconds.
Hyper, is there anything like?
Sorry?
How many words we are left with?
One. I'm going to give you that hint
Oh.
even though I'm not allowed to.
Oh.
Do you guys have a diagnosis on the basis of the words you found by now?
Can you repeat the words? Frenuloma. What are the words?
Frenulum.
Stroke frenuloma.
Time's up.
Paranoid syndrome.
Time's up.
Okay, you get 1 point for paranoid syndrome, but you don't get any points for finding the clues because you did not find them all.
Oh. What was the word we missed?
Sorry?
What was the word we missed?
The third word
One
was
word.
hydrocephalus. It was right at the bottom.
Hmm.
In the first row.
We were going diagonal.
Yeah.
Okay, so Amol, who do you support? The tibial titans or the fibular fighters?
So this was such a challenging round and I was so stressed out. So can we have the fibular fighters here first?
Yeah.
So we have people from the team fibular fighters coming back. Are you guys excited about how their round went? Do you guys want to discuss how challenging the rounds were?
Oh, I know that you guys worked way more than we could do. So
So we're at the end of round 2. And team, I don't even want to announce who went first. Can we have the score reveal first? Do we have the scores ready yet?
Yeah, we have.
Yes, we do.
Oh my God.
Congratulations, team fibular fighters. You guys escaped the room with 2 points since you found all your clues and your diagnosis.
Yay.
Team tibial titans scored 1 point because they figured out the diagnosis, but they could not find all the clues.
Okay, guys, so are you now ready for the last and the best round of all the game? Yes, no?
Yay.
Yes, I want some excitement. Come on. I know we're all tired, but yay, yes, I see. So for this round, we will continue with the lower limb, okay? Now we will go to the feet. So I'm gonna give you the division for this round. And again, please change your names as we have been doing this all day. So we're going to have two teams. We're going to have the calcaneal cyborgs, which is CC, which Javiria, and Jose. Okay? So change your name to CC, calcaneal cyborgs. And Abby and Kalika are going to be the navicular ninjas. So you're going to be NN, navicular ninjas. So I'll wait for you to change. Yes.
Yes, sorry to interrupt. Team Tibble Titans, you guys can stay tuned via our YouTube. Yeah. But can we have the contestants now, please? Thank you so much for participating. You guys made this a success.
Thank you, Amol. I was going a little bit too fast. Okay, guys, so did you all change your names? Yeah, we have Jose and Javiria, CC, perfect, and Abby and Kalika are NN. Perfect. Okay, guys, for this round, I will need you to refresh and recharge your energies. So go and grab a coffee, a candy, whatever you want before we start. But most importantly, go and grab an A4 white blank paper because it's going to be your signal for this round, okay? I will give you 5 minutes for this. Okay, guys, now that your sugar levels are higher, you rest a little bit. We will start with the rapid fire connections part. As the name itself says, this part will be fast and thrilling. This round is based on wordplay and picture association. Let me explain to you how we will proceed. It will be a rapid fire round, with the first team to identify the disease being awarded 1 point. I'll give 20 seconds to each team to discuss. After the first 20 seconds have passed, the next team will start to discuss while the first team has to stop their discussion. This part is really important, okay? After both teams finish the discussion, I will give you a sign to raise a white paper, making sure it is visible to your camera. That's why you needed the paper. The first one from either team to show the paper will have to answer, okay? You cannot think or take time after raising the paper. Just blurt out the answer. So if the answer is wrong, I will give the other team a chance to reply the same question. If both teams are wrong, I will give you a clue, but sadly, I take 0.5 point from you. You will get 1 point for each correct answer, and the team with the highest overall score wins the round. And guys, please remember to follow our most important rule. Only one person can speak at a time. Also, remember your mics have to be unmute the whole time and that you have to show your hands, please, okay? So guys, are we ready to start? Any questions before we start?
Yeah.
Sure.
Yeah, Kanika, go ahead. Yeah.
Yeah, when we would be discussing, wouldn't the other team know what we're discussing?
Yes, but it could be good or bad because you don't know if the discussion is going to be good or bad. And we're going to, for example, if you start the discussion in the first question, the other round, the other team will start the discussion. So it will be fair for both teams.
Sounds good.
Okay, and I will be keeping the timer, Lucio. I will let you know once the 20 seconds are passed.
And guys, make sure that your paper is really visible to the camera.
And can we keep our hand like this so that we can just raise it?
Yes.
Okay.
And remember, it's the fastest one. So you have to be fast.
So Rocio, we do the discussion first and then we write. And when you ask us to raise, then we raise, right?
Exactly. Yeah, you cannot raise the paper until I say raise the papers. And then it's just a race. The first one gets the answer.
Are we supposed to write the answer?
No, just in your head. Or you can write it down if you want, but...
Okay.
Like how
don't show the answer in the paper. Don't show the answer in the paper. Just in your head. The paper is just for us to know who knows the answer, who is willing to reply.
Okay.
Got it.
Sounds good.
Sure. Other question?
How many turkey questions, Rocio?
That's a surprise.
All right. Accepted.
Okay, so we're the team Navicular Ninjas is going to start with the discussion, okay?
Okay.
I will tell you when your 20 seconds start and you can start discussing. After that, I will tell calcaneal cyborgs, you can start your discussion, and then I will say raise your papers. Okay? Okay, guys, so we're going to start with the first question. Navicular ninjas, your 20 seconds start from now.
Kalika, if you are really sure, then we might not even say the name of the disease. So,
Okay,
but if I have no idea as of now.
you don't? Okay. Is this
Okay, time's up.
Okay.
Okay, team, show the question. 20 seconds starting from now.
Okay. Javiria, you have an idea? Something?
I think it's a molar pregnancy, maybe snowstorm appearance.
Time's up.
Time's up. Okay, guys. So, do you have your papers ready?
Before that, Rocio, if we like give it a shot, and if we are wrong, and none
The other team gets the chance. Yes.
and even if they don't answer, then you give the hint to both,
Then
right?
I'll give the clue. Yes, and the first team is going to try to answer with the clue first, and if they don't reply, I'll give the chance to the other team.
All right.
Okay. All right.
Okay, so raise your papers now. I think Avi was the first one. What do you guys think?
Yeah.
I would want to go with phobia.
That's incorrect. I'm sorry.
Fine.
Who raised the paper first? Javiria or Jose?
Jose.
Jose? Okay, Jose.
I think that probably is Lyme disease.
No, that's incorrect. Okay, guys, so I'll give you a clue and then I will say raise your papers again, okay? The clue is that this disease starts with S-U-B, SUV, okay? So raise your papers.
SUB. That's why there's a submarine there.
Yes. Submarine, spider, blood, the Hulk.
Okay, Javeria is ready to answer.
Okay, Javeria, sorry. What's the answer?
It's subarachnoid hemorrhage.
Yes. Say it again.
Subarachnoid hemorrhage.
Yes, perfect. Congratulations.
Well done. Well done. Good job.
Yeah. Yes, that was really hard, right? Even with the clue. So your team, which is the calcaneal cybers, gets 0.5 points, okay? Okay, so now you have to start the discussion, the calcaneal cybers. You're going to get your 20 seconds first, okay? So we'll ask our team to please show the next images. Okay, guys, so now I'm going to show you the picture. The calcaneal cybers are going to start the discussion this time, okay? So I will ask the team to please kindly show the next question.
I have the timer ready.
Perfect. 20 seconds starting from now.
Jose,
Hey,
do you have any idea what that is?
I don't have an idea yet.
What do you think it is?
Oh, I have an idea.
Time's up, guys.
Okay, time's up. So now we're gonna give the navicular ninjas 20 seconds, starting from now.
Any idea, Kalika?
I was thinking about something, but it doesn't match anything else. So I really don't know. Some deficiency, maybe.
RC. No.
And your time is
Time's up.
Time's up. Okay, guys, so raise your papers now.
I have a question.
Oh, wait, sorry. Okay, what's the question?
I need to say, I can describe the disease. Is okay in that way?
Name.
No, the name of the
You
disease.
have to name the disease. Okay, guys, raise the papers now. Okay, Jose. Yeah.
Okay, it's an infection of Yersinia pestis?
There's a message in the chat box, guys.
Kalika went first.
Okay,
What do you guys think? The others. Okay. So we'll go with Kalika.
Is it vitamin deficiency?
No, it's not. So we're going to give the navicular ninjas a chance. I think neither of you raised the papers, right?
Jose raised the paper, right?
Oh yeah, sorry. So now we're going with Jose. Sorry, my mistake.
Okay. Is an infection of Yersinia pestis that cause buboes in the body or in cities of garbage with a lot of garbage? No?
No. I'm gonna give you guys a clue. The
Mhm.
first image, you can see dew. Okay? And
Rosie,
actually,
the
yeah,
only
sorry.
that was the only thing I already knew.
Well, sorry about that. That's the clue that I can give you. And actually, my name in English is Dew, Rocio, and in English is Dew. Okay, so you can raise your papers again.
What was the clue again?
That the first image, it's dew. So the disease starts with dew.
Oh, yeah.
Avi?
Yeah.
Yes, Abby.
Dubin-Johnson syndrome.
Yes, perfect. So you get 0.5 for the navicular ninjas. Okay, guys, so now navicular ninjas are going to start the discussion, okay? Perfect. So please, team, display the image, the next image. Okay, guys, so 20 seconds to the navicular ninjas starting now.
Some sort of gynecological disorder.
So I know the first two symbols.
And I think it makes sense of the last two, but put them together.
Okay.
Time's up.
Okay, so now we're giving 20 seconds to the calcaneal fibers. Starting from now.
Jose, do you have any idea?
Not yet. Okay.
I have no idea as well.
Time's up.
Time's up. Okay, guys, so raise your papers now.
I don't see any paper.
Yes. Do you want more time or you want a clue?
Clue, please.
Okay.
A clue?
Clue.
Okay. Avi's raising his paper. Avi, are you raising the paper?
I think it's okay. You can give a clue. I don't want to waste time for anyone.
You can shoot your shot.
Okay, could the hands of all the participants to be visible to the camera, please?
Okay, Avi, do you want to say something or no?
Some Oppenheimer's disease or something. I don't know.
What?
Oppenheimer's disease.
No.
Yeah.
Sorry about that.
Jose wants to answer.
Okay, Jose.
Jose.
Vasa previa?
No.
No?
No.
Jose, can your hands please be visible when you're not answering? Can your hands be visible to the screen?
Okay, guys, so I'm gonna give you a clue, okay? The clue is sun.
Sun as in S-O-N or U-N?
S-O-N, sun. This is not the first word.
Javiria wants to answer.
Javiria.
Autism spectrum disorder?
No, it's not.
Kalika.
Is it Huntington's disease?
No. Jose.
It's Rett disease.
No.
Do you want to give another hint, Rosia?
Okay, guys, I'm gonna give another hint because it seems like no one is getting the answer. Do you agree, guys?
Yep.
Yes.
Yep.
Okay, so I'm gonna give you a son is how the disease ends. Okay, so I'll give you now how the disease starts.
Mm-hmm.
It's Z, as zebra is the first letter.
Oh shit! I know this.
Come on, guys, now it's easy. Starts with Z, ends with son. Kalika.
Zeal-Nielsen syndrome?
What?
Zeal-Nielsen syndrome?
No. Remember, starts with Z, ends with son. It's a composed word.
Oh yes.
Avi.
Zollinger-Ellison syndrome.
Yes. Okay, so 0.5 to the navicular ninjas. Yes, this one was really hard.
You know what? I was so overthinking that the first symbol is the symbol of that Opel company, the car manufacturer.
Oh, yes. Thinking in terms of hereditary disorders and something like to do with direct transmission to the sun.
Oh God.
Okay, perfect. So now we will move to the next question. So now the navicular ninjas are going to start the discussion, right? Or should the calcaneal cybers? I don't remember who started last time.
Last time we started, I think now the cybers.
Okay, so now we're going to start with the cybers. 20 seconds starting from now.
Jose, are you able to listen me? Do you have any idea about this?
No, I don't have any idea.
And your time's up, guys.
Time's up.
Time's up. Okay, so navicular ninjas, 20 seconds starting from now.
Kalika, I know the second word. Do you know the first word?
It's a hummingbird, I suppose. And is that lion faces or I don't know. And then that's cannabis and that's a drone.
The last one, what did you say?
Drone, cannabis.
No, the fourth, the man.
Lion
Time's
faces.
up.
Time's up. So now raise your papers. Javiria. Yes, Javiria.
Is it leprosy?
No, it's not. So now I'm gonna give the chance to the navicular ninjas. Avi or Kalika.
Mm-hmm.
Do you want to reply or you want a clue?
Just can you give us like a few seconds?
Okay.
I think we'll get the clue.
Yeah.
The clue?
Yep.
And
Okay.
don't give us the second word as a clue, please.
Please give the second word as a clue, please.
No, it will destroy us.
Yeah, second word.
No,
The
we know.
the clue is man.
Okay.
Okay, Javiria, could you have your Google Meet camera on?
Oh.
Yeah. I think I know what you're thinking. Yeah.
Yeah.
Avi.
Beckwith's syndrome.
No.
Not. Oh.
This round is really hard, guys.
Did you say man as the clue?
Yes.
Yeah.
But that doesn't mean that the disease starts with man. It just has a man somewhere in between.
So that's a part of the word?
Yes.
Oh, Jose wants to answer.
Jose.
Angelman syndrome?
What?
Angelman syndrome.
No. Look at the images, guys. What do you see? I told you the man. What is next to the man?
We can discuss with our partner, right?
No, because we already passed that part.
Okay,
Now
so
you just have to discuss with your head, with your brain. I'm just trying to help you.
Jose is raising paper.
I'm
Jose.
Oh, sorry. No,
Oh, okay. You have a man. What is this thing next to the man?
Yeah,
The
that's
leaf. What is this leaf?
Oh, can I answer?
Okay, Avi.
Beckwith-Wiedemann syndrome. I know
Yes. How do you get that?
Beckwith-Wiedemann syndrome.
Wow, I was thinking.
Wow, yes, that is amazing. I don't even have to explain this question because Avi already explained all the clues. Oh my God, yes. I wouldn't have gotten this answer right, to be honest with you guys.
I just want to appreciate the man whoever has made these questions. They're pretty fun.
Genius.
Yes, we want to thank our team because they are amazing and they have been working really hard for this. So why don't we give them an applause in the meantime? Thank you, guys. Okay, so now Navicular Ninjas, you're going to have 20 seconds to discuss, okay? So I will ask our team to please show the next image. Okay, 20 seconds starting from now.
Kalika, do you know what the last word is?
Is it a burger?
It's fine.
Is it meat or burger with cheese? I think.
Pile, or
Time's up, guys. Time's up.
Time's up, sorry. Now 20 seconds to the calcaneal fibers, starting from now.
I have no idea.
Any image that you know, Jawaria?
What do you think?
I don't know. Okay.
And time's up, guys.
Time's up. Okay,
we have a
so
secret participant waiting. I think Sibi wants to answer.
wait. Okay, so raise your papers starting from now. I think we'll have to give a clue.
Yeah, I think all of us need it.
Do you all agree?
Can I answer?
Yeah.
Yes.
Is it Takotsubo cardiomyopathy?
Yes. Oh my God.
Wow.
I think Kalika deserves an applause for this. She's the first one to reply to the question in the first round without any clue.
Javeria answered it, or Kalika answered it. Sorry, I couldn't hear it.
Kalika.
Oh, okay. Congratulations,
Oh
Kalika.
First one complete point.
Yeah.
Yeah, first complete point.
Yeah, good job.
Congrats.
Talk, OT, sumo, cardio, mayonnaise, and patty. I think.
Yes. Yes. Congratulations. Okay, guys. So now the discussion is going to start with the calcaneal cyborgs, right?
Yeah.
Okay, so I'll ask our team to please show the next image. 20 seconds starting from now.
Hey. Jawaria, any idea?
Okay. Time is up.
Over. Now 20 seconds, student navicular ninjas. 20 seconds starting from now.
Any words you could pass there?
I know a couple, but I'm not sure how to piece them together. Do you know what the third one is? And if the third one and if the fourth one is schizophrenia or anxiety? Not sure.
Yeah, and psychosis.
Time's up.
Time's up, guys. So now raise your papers.
Javeria, could we see both your hands, please? And Avi as well. You guys can have your papers in your hands. Just have your hands visible. Perfect.
You can tell me when you want the clue.
I think now would be good.
1, 2, 3.
Yeah.
Do you all agree with the clue?
We agree.
Yeah. Yes.
Okay. Okay. So the clue is attic.
Oh.
You can raise your papers starting from now. Attic. This disease has the word attic somewhere in between. Come on, guys, I know you can do it. Attic.
Okay.
Yes, your
I think,
paper.
Who?
Okay.
Avi?
Almost there.
Oh.
Okay, Avi.
Lymphatic filariasis.
No. It's easier than that, actually. Calcose or Javiria, do you want to try to answer? Or should I give another clue?
Another clue?
Another clue? Do you all
Yeah.
agree? Okay, guys. So the first image, don't focus on the light. Focus on the other thing. The other thing that starts with the letter P.
B for bat.
P as pineapple.
Pineapple. P.
P, attic.
Oh.
If you know the answer, you can raise your papers. P as piña colada, said Sivi. I will have to drink a piña colada after this.
Yeah.
Definitely.
Yeah.
Avi.
Okay.
Pancreatic carcinoma.
No. Calcaneal fibers. Do you want to try?
I don't know.
Or another clue?
Oh. Yes.
Another clue? Okay, but as soon as I finish the clue, you can raise your papers. You have to be fast, okay?
Okay.
The last one is order. The last picture is order. So we start with P as piña colada, we have attic, and we have order.
And if you guys don't like, now this is the last warning to everyone.
I think we'll just skip the question if you don't get this. P, attic, order. Avi.
Yeah. Avi.
Post-traumatic disorder.
Yes!
Oh, post-traumatic
This
stress.
one was easier than the others.
I meant post-traumatic stress disorder so that there's no issue later. I knew it without any idea.
Okay, let me explain to you the pictures. The first picture is a post. That's why I was saying to you, don't look at the light. Just look at the post. Tram, post, tra. There you see the attic. Is that even an attic? I think it looks like a church more than an attic, right?
It is an attic under construction.
Oh, yeah, that's true. Then we have stress, disorder. Okay?
I was thinking about Kabi. I was like,
oh, no, it was
But you
just
did
like
really well by giving us attic as the first hint, because I don't think we could have reached the attic.
Yeah,
so
no.
that's really nice.
Yes, that's why that was the first clue.
Yeah.
Okay, guys, so now we're in
Well
question
done, Navicular Ninjas.
We're now going to question number 8. Now the discussion should start with the navicular ninjas, right? You can correct me if I'm wrong, because I think I don't have more attention for today. Yes, I'm right? Okay, great.
Okay.
So team, please display the next picture. You have 20 seconds starting from now.
What's the third one?
That's the one I am also confused with. Oh, yeah. I got it, I think.
I got it too.
Okay. Time's up.
Time's up. Okay, now we're gonna give 20 seconds to the calcaneal fibers. 20 seconds starting from now.
Okay. Okay. Javier, any idea with the third image?
Time's up.
Time's up. Okay, guys, so raise your papers now.
Okay, Kalika.
Kalika. Yes. I think these images are actually a little bit confusing because look at the passport. Whose ID is that?
Mr. Parker, Spider-Man.
Yes, that is Spider-Man's passport. If I saw that picture, I will go for like Spider-Man.
Yeah.
So we have the rice. We have rice. No, a spur. I didn't know that was called spur, to be honest. I had no idea.
Oh, that's the spur of the boot. Okay, got it.
Yes. ID and oasis. Okay, guys, so last question. Calcaneal fibers are going to start the discussion now, okay? Jose and Javiria, 20 seconds starting from now.
Okay. Sister de largo.
Your time's up.
Time's up. Navicular ninjas, 20 seconds starting from now.
You are just increasing the number of photos for us. Stop.
Is it wake or sleep or alarm?
That's I would want to go with alarm or clock, maybe not clock. It's way yo waterfall.
And your time.
Time's up. Guys, raise your white papers starting from now.
Okay, Jose.
Jose.
I'm not sure. Coccyliomycosis?
No, I'm sorry, it's not the correct answer. Navicular ninjas,
Wait, what
Abby
did
or
you say?
Kalika?
What did Jose say?
What do you say, Jose? Can you repeat it?
Coccyliomycosis?
Coccydiomycosis.
Uh,
If you don't want to replay it, you just tell me to give the clue.
Any idea, Kalika?
I have like bits and pieces, but no.
Okay, we can do with a hint.
The hint,
That's
yeah.
everyone's
Okay,
time.
so I'll give you a hint, which is going to be a letter in the middle of the name of the disease, which is Los Angeles, which is LA.
That was explanatory.
La. I will also tell you that it's a composed word.
What does that mean? Can you guide a little, Rocio?
That is not just, for example, I don't know, it's not just diabetes, it's diabetes mellitus.
Like diabetes mellitus, like that. Is it like that? Like 2 words kind of a thing? Okay.
Yes. Not actually 2 words, but more than one.
More than one. Okay.
Okay. I gave more than enough clues. So guys, raise your papers now.
The more pictures you have, the more clues you get.
Yes.
The more sense this senseless mind has to make.
La.
La 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 la.
La is okay. I will say another clue because I want to see who wins today. It has 3 words.
Okay.
And the word in the middle, sorry, I shouldn't use that finger. The word in the middle starts with la.
What is it called?
The word in the middle starts with la, and you have 3 words. So, la,
And la is the complete second word?
No, it's the beginning of the second word. What do you see in the first image?
Wake.
At what time do you wake up?
Like, do I need to look at the time as well? 8?
No. At what time? Like morning, afternoon, evening?
Oh, I wake up in the afternoon. I don't know what this guy.
Like at what time you should wake up?
That's a well-framed question.
In the evening on a good day.
Yeah. Should you wake up AM, PM? I just gave you like a major hint.
I am trying to solve the quiz myself, but I couldn't get any of those.
Can I answer?
Yes.
Is it amyloidosis?
No.
I
Remember,
think I got the
3
answer.
words.
I want to just. I know it's not the right answer, but so that Kalika gets the hint, maybe it's in that direction. Amaya.
Oh, I got it.
Okay.
Kalika.
It's ALS.
Yes. Amyotrophic lateral
sclerosis.
Yes, congratulations. Because the first one you have AM.
Yeah.
Joe. Joe Tropic.
Okay.
Oh, LA. Trail. Okay. Then you have sclerotherapy.
Okay.
And cis.
Oh God.
This was hard. Yeah, I think this was hard.
Especially with what energy we have left.
Yes. Even I don't think I have any energy left for today.
It's been a long day now.
Yeah.
But doesn't Omar look like a game show host, like an actual game show host right now?
Oh, do I?
Okay, guys. Now that the round is over, we will keep the scores a secret till the end. Omar, Amol, do you agree?
Yes.
Yeah.
For sure.
Yes. Okay. So we're going to announce the prizes now. Do you want to know the prizes?
Yes, please.
Yes. Okay, so each of our winners will get a 3-month subscription to Ambos QBank, a 3-month subscription to MedQuest, a Matter Resident curated program list, 1 month of Master the Boards, and VIP tickets to the IMG event next year in New York. Our winners are going to walk away with all of these amazing resources. Can you believe that? Now I wish I had joined the challenge, not as a host, but as a participant, because I'm really jealous of those prizes. So, Omar, what would you do if you had won today?
I would prepare my step 2 CK
with MedQuest and Amboss and master the bots, then use Match a Resident for my curated program list, and then just go to the IMG event.
Take me to.
Yeah.
So this evening or morning for some of you has been really exciting, enlightening, and like super exhausting for all of us. But I guess it was worth it because it was fun, right, guys?
Yeah.
Was it fun?
Yeah.
You have to reply now.
What
Avi,
about you,
Kalika,
Kalika?
Jose, Javiria.
Hats off to the team. I mean, it was a genius idea for this challenge, and especially it was so thrilling. And at every turn, there was a new challenge, and like you guys challenged us to our best. We were literally sitting at the edge of our chairs. So well done, guys. It was a great, great evening. Congratulations.
Okay, Avi?
It was being a fan of quizzes and well-conducted quizzes. I could not be any happier. Obviously, like all our bodies are tired, but you guys made sure that we happily stick with you guys till the very end. And trust me, it's not easy. So kudos to the people we see here and the people I know are backstage. All of you are doing such a great job. Congratulations.
Congratulations. Okay, what about you, Jose?
Well, this event was an amazing initiative. Project ING managed this event amazingly, and the gifts for the winners are amazing too. Hope this event continue each year, and thank you for Project ING. Congratulations.
Okay.
Javiria.
Can someone please read the comment? It's genius.
Avi literally started in deltoid and ended up in navicular.
I am glad in a little way that so at the end of it, all of us have some representation in the finals then, including all the deltoid daredevils.
You went from the upper limb to the lower limb. And Stevie
All
says
the
you had
way.
to decussate.
So I think Javeria is trying to answer. Javeria, how did you like today's challenge?
I said that I'm really excited to be a part of this challenge, though I had a lot of internet issues because I was in hospital and I could not take off from my duty. And it was very beautifully organized, and I hope these type of challenges go on in the future too.
Thank you so much, Javiria.
Yeah, we're going to have a
And thank
season 2.
Thank you for that.
We want to thank you all for being here today. Project IMG is a big family, and today we felt the whole community's support. We also want to thank our sponsors, Amboss, Metro Resident, MedQuest, and the IMG event for making this possible.
Now, the moment we have all been waiting for. First, let's start with a round of applauses for all the participants. They gave everything today. Guys, today you all deserve a good rest after this and a piña colada. So,
so do we.
yeah, so do we. Okay, so who do you think won today? To all the people watching us in YouTube, please leave your responses in the chat. Who do you think won today? Amol.
I'm going to support the team I started with, the Deltoid Daredevils. So I'm going to support Navicular Ninjas.
What about you, Omar?
Okay, so I will be supporting the cyborgs.
The cyborgs. Okay, guys, so now I will ask our team to please display the results. We're going to start by announcing the winners, and then we're going to announce the scores. So team, whenever you're ready, please show the results. Oh my God. And the winner is, okay, let's go. The Navicular Ninjas, Kalika and Avi.
Congratulations.
Congratulations, guys.
Congratulations. And great job, Jose and Javeria. You guys did great.
Yeah,
Yes, I
There's-
want to thank you for participating. The scores were really tight and you all did a really good job. I don't know if we can show the scores or we can just stay with the winner, but okay, yeah, here we have the scores. So the Navicular Ninjas had 3 points in this last round and the Calcanials 0.5. So congratulations, guys. This round was really tough, don't you agree?
It
Yeah,
was
and
tough.
the end, it does not matter who wins or lost. They came through the screening process, then round 1, then round 2, then round 3. So it was a long process. Kudos, guys.
Yeah.
And this was as vigorous as it gets. So congratulations, everyone. But we cannot close this activity without first thanking our founder, Dr. Victor Sebastian Arurarana. He created this big family and has devoted his career to helping IMGs.
Also, I want, sorry, no, Omar, go you.
Okay. Also, thanks to my co-hosts for all their energy and for keeping us entertained during these 3 hours. Or much more. Finally, we want to thank our managers who made this show possible.
So goodbye.
Thank you.
Adios.
The office.
Great
And we
night.
will see you soon.
And also, again, I just want to say that the fact that like this team one, which has half of Daredevils and half of the Quad Squad, I think it's such a symbolic, beautiful thing that all of us won. And and just in the spirit of quizzes, I think it went super interesting from everyone losing almost everything and making it up towards the end. Every round was so well planned. And I think like it might even come across how beautiful it was. It might be scripted, but that is the beauty of quizzes, that how unexpectedly adventurous the whole thing can be. And kudos to all of you once again. Thank you.
So guys, everything that went today on screen and whoever is watching it live, it's all because of these people over here on the screen. Yeah, and there are some people who couldn't make it to the meeting over here, so it's them as well. So kudos to them. If it wasn't for them, we couldn't have pulled this out. So thank you so much.
Which was your favorite round? Avi and Kalika, which were your favorite rounds?
Round 3.
I mean, all 3 of them were differently beautiful. First one was super stressful, but in a good way. And third one was like, oh, there's so much. It was like super appreciative, the amount of effort you guys put in. So pretty cool.
Thank you.
Can we just have Tejaswini and Carol up the camera so we could have a picture? And Swati as well.
Yes, but Swati wanted to join.
Yeah.
There she is.
Okay.
Even I want a filter.
Okay.
You can be the devil.
I think that should be Avi, no?
Okay. So who's clicking the picture? On the count of 3.
I'll click it.
Okay.
You'll take
so
it? Okay.
on the count of 3, 1, 2, 3.
Yeah, I think I clicked a lot of them.
Okay,
so
that's
yeah.
enough.
I took screenshots.
So I hope you guys had fun. So the main motive was to have fun and knowledge combined together. So thank you so much.
Thank you, guys.
Yeah,
Thank you,
thanks
guys.
you all.
Bye.
Bye-bye.
Thank you, guys.
Thank you. Bye-bye. See you.
Bye.
Bye-bye.
Let's close USMLE Challenge Show Season 1. Bye-bye.